Dr. Heidi. So good to have us back at our usual programming on a Tuesday. And I'm really excited today because I've got a really interesting topic to talk about, and it's pregnant and postpartum dogs, and how we can make that journey super easy for them, and obviously like Doggy Daily in the mix of that, and is it safe? So if you're okay, I'm going to just jump into our first question, if that's good.
Absolutely. Hit me. What have you got?
Cool. Okay. How do a dog's nutritional needs change during pregnancy and nursing?
So pregnancy is really interesting because we split it into thirds. The first third, the middle 2/3, and the latter third. So nutritional needs don't actually increase dramatically in that first third. A lot of people think they do, and even the first 2/3. That's not where all the action's happening, really. So, a healthy female dog, we call a bitch, generally needs very close to her normal nutritional energy requirement during that first 2/3 period of, her pregnancy. So most of the fetal growth occurs in the last third of pregnancy. Pregnancy in the dog is about 62, 63 days. So if you think of 20 days, 20 days, 20 days, that makes it nice and easy for people. So a dramatic improvement in the last 20, 21 days of pregnancy. And that's when the nutritional demand really accelerates. So that mum might need 20 or 30% more, depending on how many puppies she's got in her litter. And her general body condition and health going into the pregnancy. So once the puppies arrive, lactation kicks in, then that's a really nutritionally demanding time in that mum's life. She requires a huge amount, about 2 to 4 times her normal maintenance energy requirement.
Wow. So 2 to 4 times. So in layman terms, are you saying like they might need 2 to 4 times the amount of food than normal?
Very energy dense food. So small amounts of food, very, very high quality food. Food that is readily digestible, easy to soak in through that stomach at pH 1, rather than, a lot of very, very complex carbohydrate, where that is broken down further down the line in the gut. Protein just sucks in through that stomach, acid stomach at pH 1, and it's straight on board. So that's a really easy thing for mum to digest and assimilate when she's got a lot going on. Bless her.
Yeah. So before we jump right into postpartum, obviously you've just said like with the food, don't feed your dog too much in the first 2. They don't need extra. It's the final with the growth. They need more support. What about the dog's gut health during pregnancy? Like if they've got bad gut health during pregnancy, is that going to affect the litter inside or like the pregnancy itself?
That's exactly correct. So this is a developing science, microbiome science, but there's some really nice studies, both in dogs and in humans, that the mother delivers the puppy's microbiome during birth. Wow. So the human studies that we know, if we have a little baby that's born by cesarean section rather than vaginal delivery, she doesn't get all of those good, positive, symbiotic bugs that they need to populate the gut, and often their gut health can suffer because of that. So we now know that microbiome health from mum is pivotal in early life for providing that 90% of those puppies' immune system moving forward. So, I like to think of pregnancy as not just building puppies, but it's their whole biological foundation that we're building for long-term health. So maternal microbiome is part of that picture, and they acquire those microbes during the birth process. But then also during birth, maternal contact from mum, so licking from mum, nursing from mum, the diet that the puppies are on, and then the whole and home environment contributes to the development of those puppies' microbiome.
That's crazy. I didn't actually know that about the cesarean to vaginal birth, that they get the extra.
Isn't that a marvellous system that's all interconnected? It's like a delivery suite on the way through. You pick up all your normal bugs, and then you've got those moving forward. That's where they come from.
Is that like that? Because like obviously when Riv came out, I can only relate it to my birth.
Yeah.
He's covered in that white stuff.
Yeah.
Is that seeping into its skin and just giving it all of that good stuff?
Protective. That's often more a protective coating in and round baby.
Oh,
But
okay.
certainly they get dumped on down the
Yeah.
hatch. You
Down
imagine
the
as they're
hatch.
being delivered. Down the
Yeah.
hatch. You get your microbes dumped on and then away you go. Yep.
So your last
And the same with
exit,
puppies.
just
All of those good. That's right. So bacteria are not bad. Bacteria are symbiotic in terms of positive for both organisms and
yeah.
living in harmony and balance. So we need to remind ourselves that bacteria are not the enemy. They are
Mm-mm.
often the nutritional foundation and the supporting immune system of the little organism that's being delivered, which is the puppy, or in some cases, the child. That's
Yeah.
how that whole beautiful ecosystem arrives. It's fascinating. That's why I
It
love the
is.
microbiome. It's amazing.
It is.
So from a very holistic veterinary point of view, I
Yes.
want mum going into pregnancy healthy with a diverse, stable, digestive ecosystem. And
Yeah.
that means quality food, appropriate fibre needed to support that microbiome, pre and probiotic foods, avoid unnecessary bacteria. We don't want a napalm bomb all the good
Yeah.
guys moving in. Manage parasites appropriately. There's a fascinating biological system whereby when a mother is pregnant, the parasites in the body can sense that pregnancy and they increase the rate at which they produce eggs through the mother to then contaminate the puppies. Sneaky little toads.
Yeah.
So those last weeks of pregnancy, parasites, so hookworm, whipworm, roundworm, tapeworm, and hydatids amp up production to pass on and infect the next generation of that litter.
Oh my God, wow.
So by supporting mum with her maternal gastrointestinal health, that's where good reproductive care comes in. Food is
Yeah,
medicine.
totally. Okay, so then if we talk a little bit about postpartum,
Mhm.
what support does a postpartum dog need that owners often overlook or just sort of forget about?
The biggest thing from my point of view as a vet, a holistic vet, is that everybody looks at puppies. I look at mum. So she's just undergone pregnancy.
Oh,
She's
yeah.
undergone labour, which, as we all
Yeah.
know, is biologically very difficult. An
Yeah.
enormous hormonal surge in her body, estrogen, progesterone. Suddenly, she's got the metabolic workload of producing milk around the clock. So that's a massive time for her. And the biggest thing that I see that owners forget about and underestimate is water.
Really?
So I've just delivered a beautiful friends litter of pedigree Rottweiler puppies sitting at her
Oh.
house one afternoon while we had coffee and cake.
Yeah.
And that was 3 weeks ago. And then I went to go and visit them at home again yesterday. And they're
Oh,
little fat, solid, chonky little bears. They look so healthy. But just reminding people that the milk that mother needs, the basis is water. So she
yeah.
needs large volumes of unrestricted water, no
Yeah.
chlorine, no fluoride. The best water is rainwater collected outside. Fluoride for dogs is also a known neurotoxin. So the nerves in the developing puppy, it's not helpful to have chlorinated, fluoridated water when you can have fresh filtered or rain water.
Yeah.
So that's something not a lot of people know, and they assume that that's okay, but you can go and have a look at and look through some research, and certainly that's the case for water. Milk production requires a tremendous amount of water, so fresh water, always accessible. Yeah. And then mum needs calories.
Yeah.
She needs energy. So much, much more than many owners expect. So during peak lactation, they would need several nutrient dense meals a day. So not twice a day. It won't cut it if particularly they've got, large breed dog, large breed litter.
Yeah.
And their tummies, if you imagine the average dog's stomach, so very different if we talk about small breed like a poodle. Their tummy is about the size of a lemon or at most a grapefruit. That's the amount of food that can physically fit in the stomach at that time.
Yeah.
And then a medium breed dog, say a staffy, their tummy could be more melon shaped, small melon. And then the Rottweiler, you're looking at a sort of more giant watermelon when it's stretched. But it's very difficult to get enough calories in to produce the energy needed to satiate those puppies who are rapidly growing. So these little Rotty puppies that I saw the other day, they're 3 kilos each already. So they've gone from being this big when they're born to being, 3 kilos. They were fat little chonky bears.
They grow so quickly, don't they?
They're just beautiful. We were just looking at them, and they're just the most beautiful, beautiful, healthy looking puppies. So it was quite a joy. But postpartum is not just nutrition. You need to also watch mum's behaviour, because some mothers can get into trouble. So they can have trouble regulating their calcium, they can get dehydrated, they can be too attentive and not leave their puppies to go outside, to go to the bathroom, to urinate, to go and have a big drink of water, to go and stretch. And then what happens is their brain, if they're dehydrated, they get a bit fuzzy, they can become hypovolemic, so low body volume, they can get a bit shocky, and they can succumb to a disease called eclampsia. Have you heard of that?
Yes. Yeah, I have,
So low calcium in the blood, and then you'll see trembling, neurological symptoms and shock from mum. That's a medical emergency. Really, really important that people watch the mother and look after her just as much as watching all the little puppies. You want to watch mum's behaviour, you want to check on her temperature, make sure she doesn't have mastitis or infection of those mammary glands, putting your hand on her tummy and on the side of the glands, making sure they're not burning hot, they're not deep purpley yucky looking colour, or even I've seen some that are black that had mastitis. So checking mum's temps, really, really important. Making sure she's hydrated, making sure there's no yucky discharge past what is normal postpartum, and checking that your puppies are gaining weight. There is a condition called fading puppy syndrome, where some puppies can't translocate from being in utero and then to surviving and putting on weight if they're not suckling properly, if they say they've been brought with a heart condition that's undiagnosed or something metabolically that's going on. Some puppies will fade and pass away in the first 2 to 3 weeks, usually 2 weeks. And that's something to look out for, because it can indicate that something's going on with mum. So it's really important that mum gets a lot of rest. And she has the opportunity to sleep deeply and be away from puppies, but also very attentive. They want to stay with those puppies. Short toilet breaks, looking after female dogs like looking after a human female that has had babies. It's quite a lot of work. And it takes the community. It's a really big job to have a female dog in the house and a big litter of puppies. It's not something that you can just walk away from, something that requires a lot of attention.
Absolutely, it's not something you just sort of decide on a whim to do. It's a round-the-clock care situation.
And then there's red flags. So red flags for the mother postpartum would be things like trembling, or she's really stiff when she's walking. She's walking really stiffly. She's weak, she's restless, the colours change, she's panting. She goes off her food and it's like, meh, don't really want to eat, not feeling quite so well, reduced milk production, or suddenly she's in such poor shape, often metabolically, but sometimes from septicemia, she'll actually ignore the puppies. That's a very bad sign. She literally is trying to stay alive, and she doesn't have enough energy or enough hydration or enough calcium to look after herself. And so often she'll push the puppies away. So those are red flags, and those are all veterinary medical emergencies. Get on the phone, talk to your vet very quickly, because puppies can fade in a day. It doesn't take more than that, sometimes half a day.
Wow.
Hypoglycemia and dehydration kicks in really quickly, and they're like little fading flowers, like little babies, and they require close management at that age.
Yeah. Those are awesome. And I'm going to pull out those red flags and we'll do like a post on those as well so people can see those clearly. My final question, and I have to ask, is Doggy Daily, because we get this asked a lot, is it safe for pregnant dogs?
So your Doggy Daily formula contains food, so pumpkin seeds, coconut, seaweed, 53 vitamins and minerals and good old New Zealand sea vegetables, turmeric, which is very safe in pregnancy, fennel, ginger, Brazil nuts, probiotic powder, and gold kiwi fruit powder, high vitamin C. So usually what I say to people, pregnancy is not the time to necessarily change up something during that period. But if your dog is a normal, active, healthy adult dog and their gut microbiome is already used to those ingredients, so you're not going to get an osmotic upset tummy, then all of those foods are perfectly safe in pregnancy. They're nutritional ingredients rather than a pharmaceutical treatment, which is often more preferable, in my opinion, for just general health and wellness and gut health during that time, which is pivotal. So from an individual dog point of view, I would look at her complete diet, make sure she has enough iodine during that time, particularly helpful because your Doggy Daily product does contain kelp and obviously iodine. So that's very helpful. Then look at mum's medical history, what medication she's on, her body condition, her stage of pregnancy. Each dog is different, just like each individual human female is different. So any supplement, regardless of what that is, should complement a complete reproductive diet, not replace it.
Yes. So complement, So you're saying, and you're saying, like, if you are already using Doggy Daily and your dog gets pregnant, like, really, it's totally cool to keep using it. But if you are wanting to introduce it, you're sort of saying, like, look at
do
it.
Do it early.
Do it early,
One of the ingredients that I love is Protex and probiotics. Beautiful product.
Good.
And so diversifies the microbiome, boosts the immune system. It's been a really long and very well studied veterinary ingredient. And so those things are super helpful, as is the vitamin C. Vitamin C is a super antioxidant. So if mum's got a low-grade grumbly viral infection or bacterial infection, those ingredients through food are very, very helpful. And we know ourselves it's a nutritionally extremely demanding time.
Very much.
So my overall holistic opinion would be that when you nourish mum, you're not just simply feeding one dog in pregnancy. You're influencing the nutritional environment of a whole new generation of dogs. And so be very thoughtful and intentional around doing that and using lots of fresh, seasonal, whole food. Fruit and vegetables are just as beneficial for your dog, including fibre, as they are for people. I think that's the bigger message. That pregnancy care begins with mum, her nutrition, her gut, and her well-being, and it's the foundation then that you pass on to those puppies for their very best start in life.
Totally. Yeah. Oh, thank you, Dr. Heidi. That was fantastic. I'm feeling, not that Jax is about to have a litter at any time soon, but I'm feeling very well informed for our customers as well now, and especially for our questions that we get.
That's great. We've done quite a lot of repro work lately. It's the time of year that a lot of dogs are having puppies. And so
Yeah.
it's part of my job that I do absolutely love as a repro
Yeah.
vet. We do regular cesareans on certain breeds, particularly some of the Boaz breeds, so the
Yeah.
Frenchies and the Bulldogs. Fortunately, my friend's litter were just self-whelped at home with me
Cool.
sitting on the couch supervising, and we
Yeah.
did have to do CPR resuscitation on one puppy. So I was
Oh,
pleased I was there.
yes. Oh, special little thing.
Mm.
Awesome. Okay, well, I'll see you next week. Ready for our next topic.
I look forward to it. Thanks, Emmy.
No worries. Thanks,
Okay.
Heidi.
Bye.